Dr.
Sure.
Senapati, what is endometriosis and what are some of the symptoms that it presents with?
Absolutely. Well, first of all, Priya, thank you for having me on the show, and I'd like to thank all the panelists as well. It seems like you guys are all going to bring a very unique perspective to this conversation that I think will be very helpful. So to start off with, endometriosis is a condition that affects about 10% of individuals who are born as females, and some of the most common symptoms that women can have can include painful periods, pelvic pain or abdominal pain that exists both during periods and outside of periods. And another common complaint can be pain during sexual intercourse. Some women with endometriosis may also note some irregularities in their menstrual cycles, particularly some spotting just before their period is due. And at this point, endometriosis is a condition that can be suspected based on symptoms, but at this point it really does require surgery to make a definitive diagnosis. And so, endometriosis is a condition in which the cells that are typically in the lining of the uterus or the womb actually present in other places. So we can see them as lesions or spots inside the abdomen. Sometimes we can see cysts on the ovaries called endometriomas, or it can present as more of a fibrotic disease type that causes internal organs to stick together. We don't know exactly what causes endometriosis in terms of why some women develop it while others do not, but there are some clear risk factors, and we do know that it is an estrogen-dependent disease that can really present very differently from one person to the next. I think one of the most important things to know about endometriosis is to understand what the symptoms are, and as many of the panelists alluded to, a lot of women suffer in silence for a long time, and sort of the average time to diagnosis of endometriosis can be many years after the initial symptoms present. So, it's something that we certainly want people to be more aware of in terms of how it can present, so that we can really direct people to who needs treatment.
You did mention pelvic pain as a symptom for endometriosis, but I believe pelvic pain may also occur due to other medical conditions. So how do you differentiate between pelvic pain due to endometriosis or for something that is due to some other medical conditions, for example, interstitial cystitis or fibromyalgia?
That's a great question, and what we do see is that many women with endometriosis can have multiple different types of conditions that can cause pain syndrome. So, for example, some women with endometriosis may also have fibromyalgia or interstitial cystitis. I think in terms of really differentiating, where is the pain coming from and therefore, what's the best way to help treat the pain, really gets at understanding some of the other symptoms that may be present. So, for example, if patients have pelvic pain that seems to be more related to when they have a bowel movement, for example, or more problems with diarrhea and constipation, that may point more towards an irritable bowel-like syndrome. And certainly similarly, if it's a bladder condition, they may notice more discomfort when urinating. So kind of understanding what are the other symptoms that come with the pain can be very helpful. And also, many patients with endometriosis may notice that the pain is more cyclic, meaning they'll notice it more kind of leading up to or kind of during the times when they're actually on their period. So the cyclic nature of the pain in some cases can help point more towards endometriosis than some of the other conditions. But I do think it's important to kind of anytime we see this, we really try to do a comprehensive assessment of other things that could be going on so that we address the endometriosis, but certainly can make sure that we are identifying and therefore, providing the opportunity to address other syndromes that could be happening at the same time as well.
Dr. Senapati, this is just my curiosity. When I was reading up, preparing for this talk, actually, as you said, I saw many of the symptoms mentioned what you just mentioned. So in your years of treating endometriosis, have you ever seen something which is so very uncommon and so very uncommon presentation of this condition, and it was difficult initially to diagnose this as endometriosis?
Yeah, so we every once in a while will have some pretty unusual cases of endometriosis. For example, a patient that actually ended up in the hospital because she was coughing up blood at the time, every time she got her menstrual cycle, suggesting that she actually had endometriosis involving her lungs, and kind of was developing fluid collections related to that. So that's one example of some of the more unusual cases that we see, and I think really speaks to the fact that while there's some things that are very typical of endometriosis, it can also, in some rare cases, actually cause problems outside of kind of the typical gynecologic types of conditions and problems that people see women's healthcare providers for. And so, I think those are situations where it can be really helpful to kind of approach things from a multidisciplinary perspective and really kind of keep it at the back of one's mind anytime you're evaluating or kind of treating a woman who is of reproductive age. Is this something that could be related to her cycles and possibly endometriosis?
Mm-hmm. Dr. Sinawati, you did touch upon causes, saying we really do not know all the causes of endometriosis. So my question is, endometriosis has been associated with several chronic diseases, like you just mentioned, and then you have cancer, autoimmune disease, asthma, allergic manifestations, and cardiovascular disease. Can you talk a little bit more about the causes of endometriosis? Also, I want to club one question that came in. I think this was one of the first questions that came in for this talk. The question is, some women with endometriosis may also have other immune disorders like eczema, asthma, and fibromyalgia. Are we saying that endometriosis is an immune disorder?
So it's an interesting question, and I think it gets at the idea that, while we've made a lot of progress in learning ways to treat some of the symptoms of endometriosis, we don't fully understand yet what exactly causes endometriosis, or kind of more specifically why some women get it and others do not. Some of the theories or kind of ideas behind what may be causing endometriosis, one of the more popular theories has to do with the idea of retrograde menstruation, or that some of the blood and endometrial tissue can kind of get flushed back into the abdomen when a woman is menstruating. And in a subset of those women, they can form these lesions or spots. There's also some theories about coelomic metaplasia, or basically cells changing a little bit inside the abdomen. The idea that endometriosis can spread through the blood and lymphatic system, which can explain some of the more distant sites of endometriosis that we see. And, there are still others that believe that there may be kind of a genetic or multifactorial component to things. What we do know is that endometriosis does seem to be an estrogen-responsive disease, meaning if we block estrogen or some of the hormones, or I should say enzymes that make estrogen, that can sometimes help with the treatment of the symptoms. And we've also seen that there can be a component of the immune system that may be altered. So immunomodulatory effects may be slightly altered in women who have endometriosis, resulting in a state of kind of chronic inflammation, which is why I think it has been associated with many other types of chronic diseases in which inflammation or altered immunomodulation may be part of the spectrum. So in response to the question, is endometriosis an immunologic disorder, I think it's in part. I think that it's a hormonal disorder, it is an immunologic disorder, and I think it can manifest in a lot of ways that can be linked to other disease processes as well.
Thank you, doctor. So we come to that question that we're going to the topic that we're discussing today. So how does endometriosis lead to infertility?
Yeah, so endometriosis is an interesting disease in that it can be linked to infertility, and about 30 to 40% of women with endometriosis may struggle with infertility, which is actually much higher than what we see in kind of the general population. The ways that we think that endometriosis can cause infertility include changing the eggs, or basically can be linked to changes in the egg quantity or quality. We see that endometriosis can be linked to diminished ovarian reserve, which is kind of an independent infertility diagnosis. We've also seen that endometriosis can certainly change the pelvic anatomy, and we can see that in the fallopian tubes in terms of causing scarring or distortion of the fallopian tubes. We've also seen that in some cases it can alter how a pregnancy implants inside the uterus, or specifically altered both hormonal functions from the perspective of progesterone resistance on the endometrium, as well as some other cellular mediated functions. And as I mentioned before, endometriosis is a state of there tends to be a lot of inflammatory cells, and we think that may alter kind of the peritoneal environment, or the general environment in which a pregnancy is occurring. So all of those factors can, independently contribute to why a woman may be having difficulties conceiving, and we tend to see those kind of manifest either individually or in kind of multiple aspects being affected in many women.